Hello, everyone. My name is Zohri Chaudhary, and today we'll talk about another topic about global health, the global health context, which applies to health literacy and cultural competence in global health practice. So, what is health literacy? In recent years, increasing attention has focused on health literacy, which is defined as the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. Until recently, health literacy was seen more as a literacy issue, like an education issue, than a cultural issue. In looking at culture and health literacy, several categories for misunderstanding between provider and patients emerge. First, there is a difference between medical terminology and lay terminology, which can occur in any language or culture. What is diastolic or systolic pressure? What is HDL or LDL? What are oncology, nephrology? These are medical jargons. No amount of education, short of experience in medicine or nursing, will help someone to understand how to navigate and obtain healthcare. Health literacy can be compromised at times, even for well educated individuals. Healthcare providers outside the United States often have a better understanding of this issue than their US counterparts in this regard of using medical jargons to communicate health information versus using more local terms to communicate health information. On the other hand, individuals and cultural differences are also important when looking at health literacy. For example, what does it mean to be moderate weight? To some women from Latin America or the Middle East, moderate weight will be much heavier than US norms, whereas a US woman who fears she weighs too much might be viewed as dangerously thin in some of these cultures. Distribution of diseases are definitely affected by socioeconomic factors, and education plays a very important role in here. Typically, better educated people tend to have better health. And we've also seen in many studies that illegal workers or illegal immigrants, they are typically at higher risk of developing occupation-related diseases because they typically are doing that type of work in their new country where they're illegal. Um, and education definitely plays a role, not being able to understand the local language and education system. In general, educational attainment is linked with health in three interrelated ways. The first, education has been linked to better health through individuals' increased health knowledge and health behaviors. The mechanism is likely explained in part by health literacy, improved health literacy. The second, education shapes employment opportunities, which are major determinants of economic resources that influence health. We just talked about this illegal immigrants taking up jobs that are very risky under those settings. And finally, education can influence health through social and psychological factors, with greater education linked to greater perceived personal control, which also has been associated with better health and healthy behaviors. Essentially, you are at a higher social standing and increased social support due to better education. A concept related to health literacy is that of cultural competence. Cultural competence in healthcare describes the ability of systems to provide care to patients with diverse values, beliefs, and behaviors, including tailoring delivery to meet patients' social, cultural, and linguistic needs. A culturally competent practitioner can bridge cultural gaps and reduce misunderstandings between cultures by being aware of and sensitive to cultural differences. Scholars have suggested that cultural humility is a more realistic framework because it promotes the understanding and appreciation of health beliefs and behaviors in their cultural context and respectful strategies to negotiate optimal health in the context of these beliefs and behaviors. Finally, another health theory is described by Talcott, and it's known as the sick role. According to Talcott, um, an individual must agree to be considered ill and to take actions to define the state of their health, discover a remedy, and do what is necessary to become well. Individuals who adopt the sick role neglect their usual duties, may indulge in dependent behaviors, and seek treatment to get well. Sick individuals behave in a certain way once they know that they are sick. By adopting the sick role, they are viewed as having permission to be exempted from day to day obligations, but they are also under an obligation to try to restore health. Thus, the sick person are excused from normal social roles, and the sick persons are not held responsible for their condition. So, wrapping up this short set of lecture slides, some critical thinking questions. If you were the person in the sick role, what roles would you be exempt from? What would you be excused from having to do? Think about it. So, the sick role does also vary from culture to culture. Do sick people always want to get better? Describe situation when they don't. Are people always excused from their normal social roles? List situations when they're not. That's all for this set of lecture. Thank you.